Applied Behavior Analysis Interventions in Autism Spectrum Disorder, a Research Proposal by Brandy Richter, Department of Psychology, Liberty University. Hello everyone. I would like to discuss the topic of this research proposal. The topic area of this research proposal is autism spectrum disorder and the long-term outcomes of applied behavior analysis intervention methodologies. Now let's talk about what autism spectrum disorder and applied behavior analysis are. I will begin with autism spectrum disorder. The prevalence of autism spectrum disorder, or ASD, in the United States is rising. The Autism Disabilities Monitoring Network tracks prevalence rates of children diagnosed with ASD. Many factors can contribute to variability between communities, including how a community identifies children with ASD. In 2022, approximately 1 in every 31 children, or 3.2%, under the age of 8 were diagnosed with ASD within the communities monitored by the Autism Disabilities Monitoring Network. Boys were found to be 3 times more likely than girls to be identified as having ASD. This chart shows the prevalence rate of autism spectrum disorder diagnoses in the year 2022. As you can see, the Texas Laredo prevalence rate was 1%, while California was 5.45%. Autism spectrum disorder was not included in the Diagnostic and Statistical Manual, or the DSM, until the publication of the DSM-3. The DSM-5 categorizes ASD as a neurodevelopmental disorder. Deficits in social communication and social interactions characterize ASD. These deficits are evident across various contexts. These contexts can include social reciprocity, nonverbal communication, developmental skills, and maintaining and understanding relationships. One with ASD also experiences restrictive, repetitive patterns of behavior, interests, or activities. As a person matures and evolves, symptoms may shift and be concealed by compensatory strategies. Now let's learn about applied behavior analysis. Behavior analysis has its origins with the publication of B.F. Skinner's book, The Behavior of Organisms. This book brought 2 types of behavior to light, respondent and operant. Respondent behavior is a reflexive behavior where respondents are brought out by stimuli immediately preceding them. Operant behavior is a behavior influenced by changes in the stimulus that have followed the behavior in the past. The experimental approaches utilized in applied behavior analysis, or ABA, were developed by Skinner. These methodologies include rate of response as the primary dependent variable, within-subject experimental comparisons, and visual analysis of data graphs. The first application of human operant conditioning was conducted by Fuller in 1949. Following the timeline of applied behavior analysis, in 1959 an article revealed that nurses in a psychiatric unit use extinction and reinforcement strategies to reduce maladaptive behaviors and promote positive behaviors. This marked the initial occurrence of empirically proven principles of behavior being utilized to address important social issues, thereby establishing the groundwork for interventions in applied behavior analysis. This article led researchers to conduct a study where they taught 2 children with autism and 2 neurotypical children as a control group to press a key by providing reinforcement using a preferred edible that was later changed to a token economy system. The study's results indicated that the researchers successfully increased key presses. Behavioral interventions focus on identifying the underlying mechanisms and environmental variables that are responsible for the acquisition and maintenance of a behavior. To ensure the protection of those receiving ABA-based interventions and create ethical guidelines, the Behavior Analyst Certification Board, or the BACB, was established. The BACB created levels of certification and a hierarchy of professional service providers of ABA-based interventions. These certifications are comprised of Registered Behavior Technicians, or RBTs, Board Certified Assistant Behavior Analyst, BCABAs, Board Certified Behavior Analyst, BCBAs, and Board Certified Behavior Analyst at the doctorate level. Literature review. What does the current research say about the long-term outcomes of applied behavior analysis interventions on children with autism spectrum disorder? I will begin the literature review by discussing three studies, Ringdahl et al., Adelson et al., and Hartz et al., which examine ABA interventions overall as a treatment for the deficits associated with autism spectrum disorder. Ringdahl et al. Conducted a comprehensive exploration of applied behavior analysis strategies tailored for interventions aimed at individuals with autism spectrum disorder. They identified a total of 28 evidence-based practices that encompass a variety of approaches designed to address the prevalent social and communication deficits as well as maladaptive behaviors associated with ASD. The authors highlighted critical ABA techniques including positive reinforcement, token economies, differential reinforcement, behavioral momentum, and various intervention strategies. Among these, they detailed discrete trial teaching, or DTT, which systematically breaks down tasks into smaller components for easier learning, natural language acquisition, or NLA, which emphasizes teaching communication through naturalistic interactions, and pivotal response training, or PRT, which targets key behaviors that can elicit broader improvements in areas like motivation and social skills. A significant focus of their work is the assertion that successful ABA interventions should be highly individualized, taking into account factors such as the individual's development level, cultural background, and family dynamics. Adelson et al. Turned their attention to a specific subset of intervention strategies within the realm of ASD treatment, investigating the efficacy of the parent-based treatment, or PBT, Forta model. They sought to determine whether the degree of treatment utilization, measured as the percentage of prescribed treatment hours, has a tangible correlation with improved patient outcomes. The researchers developed three primary hypotheses centered around this concept. They theorized that increased utilization of the PBT model will result in enhanced outcomes in composite scores as well as specific improvements in communication and executive functioning scores. Their findings aim to provide insight that could refine the application of the Forta model in real-world settings, emphasizing the critical role of adherence to prescribed treatment protocols and the importance of family involvement with the treatment. Hartz et al. Investigated the effectiveness of behavioral interventions for spitting behavior in a 12-year-old individual with autism spectrum disorder and intellectual disabilities. The study aimed to explore how various interventions such as functional communication training, or FCT, and non-contingent reinforcement, or NCR, could reduce or eliminate this behavior. Hartz et al. Formed four hypotheses regarding the influence of social and non-social factors on spitting behavior, the effectiveness of tailored interventions, treatment variability over time, and the predictive ability of screening assessments for automatic reinforcement. A functional analysis was conducted, and an A-B reversal design was utilized over 57 weeks, combining interventions that included differential reinforcement and non-exclusory timeout. Results showed a significant reduction and eventual elimination of spitting behavior, with follow-up assessments indicating lasting changes. However, the study had limitations, as did the other two studies. All three studies emphasized the objective of improving clinical outcomes for individuals with ASD through effective intervention strategies. Each article acknowledged the importance of collaborative approach that involved active participation from family members, highlighting the necessity for parents or caregivers to be adequately trained and supported. Ringdahl et al. Stressed family engagement in the practical implementation of ABA strategies. Allison et al. Examined the impact of parental involvement on treatment outcomes with a PBT framework, while Hartz et al. Focused on the role of caregiver education in enhancing intervention effectiveness. We will now look at some studies that looked at the long-term outcomes of applied behavior analysis. Zhu et al. Undertook a rigorous investigation to assess the longitudinal effects of two interventions, applied behavior analysis and the Early Start Denver model, on children diagnosed with autism spectrum disorder over a 6-month period. The research was underpinned by 3 critical hypotheses aimed at understanding the efficacy of these interventions. The study involved a total of 60 children diagnosed with ASD who were recruited from 2 hospitals. 30 children participated in ABA interventions at one hospital, while the other 30 received ESDM interventions at the separate facility. The research utilized a comparative longitudinal efficacy trial design to conduct the assessments in naturalistic settings, including home environments, clinics, and schools. To evaluate the children's progress, assessments were conducted using the PEP-3 assessment tool, which covers multiple developmental domains such as language skills, social interactions, and both fine and gross motor abilities. The researchers conducted an exploratory analysis, particularly focusing on social reciprocity and gross motor skills, which are critical areas of development in children with ASD. After a 6-month intervention period, the results indicated the ESDM group experienced substantial improvements in several areas. Conversely, while the ABA group exhibited better improvements in gross motor skills, the difference between the ESDM and ABA were not statistically significant after adjusting for irrelevant statistical corrections. The findings also highlighted the importance of tailoring interventions based on individual characteristics such as age and baseline symptom severity. Younger children and those with milder symptoms show a more robust response to ESDM, suggesting that intervention strategies should be customized. However, Du et al. Acknowledged several limitations with their study. Ithiraj et al. Conducted a focused study on the long-term effects of ABA-based interventions, specifically on social communication skills and social maturity in children with autism spectrum disorder. The research put forth 3 principal hypotheses. They defined joint attention as the ability to coordinate attention between people and objects, a crucial skill for effective communication and interaction. The study involved a sample of 60 children diagnosed with ASD, focusing on assessing the effects of ABA interventions on their development outcomes over an extended period. Ithiraj et al.'s findings contributed valuable insights into how ABA effectively encourages critical social skills. The study emphasized the importance of joint attention on a precursor to further enhancements in communication and social interactions. The researchers showcased that improved joint attention skills fostered greater engagement in social contexts, ultimately leading to better communication and maturity in social interactions. Both studies emphasized the significance of ABA as an effective intervention for children with ASD, underscoring its role in improving developmental outcomes. Each investigation utilized a similar participant pool, recruiting 60 children. This consistency allowed for a comparable exploration of the effectiveness of interventions within a similar demographic group. Both studies employed quantitative measurement tools to assess participant outcomes. Both studies also concluded that tailoring interventions to fit individual characteristics significantly enhanced their effectiveness. The importance of personalized intervention strategies was highlighted as a necessary approach in achieving optimal results. We will now turn our attention to the current research that focused on the effectiveness of ABA-based interventions. Nisi and Sharif sought to explore the efficacy of applied behavior analysis methods and the influence of therapy duration on the developmental progress of children diagnosed with ASD. They posited that that children receiving ABA therapy would experience significant improvements in vital areas such as communication, social skills, and overall behavioral development. Additionally, the researchers hypothesized that increased therapy duration would be positively correlated with enhanced progress. To investigate their hypotheses, Misi and Sharif adopted a qualitative research design that combined a literature review with a case study and data collection over a 3-year period. The study centered on a 3-year-old male who had been diagnosed with ASD at the age of 2. He is recruited from a local therapy center or school specializing in ASD treatment. The child underwent an initial assessment to confirm his diagnosis and his appropriateness for the study. The child's individual education plan was integrated into the ABA therapy, which involved 4 to 5 hours of treatment each week. The findings of the study were compelling, revealing notable advancements in the child's communication skills and social interactions, along with a marked reduction in maladaptive behaviors. Notably, the data indicated a strong correlation between the duration of therapy and the level of improvement, suggesting that children who underwent longer periods of ABA intervention exhibited greater progress. The study included visual representations which illustrated significant decreases in behaviors such as stereotypical actions and aggressions post-therapy. Individual variations in progress were acknowledged, highlighting that factors such as baseline skill level and active engagement in therapy could impact outcomes. Parental perspectives provided additional qualitative insights that reflected caregiver satisfaction and belief in the effectiveness of ABA interventions. Fondi and Zahuruddin, in contrast, targeted a distinct but related aspect of ABA therapy, focusing on its effects on academic achievement and social skills in children with ASD. The study aimed to assess how ABA strategies can improve not only behavioral outcomes, but also facilitate better performance in academic settings. It highlighted the positive impact of ABA-based interventions when implemented and reinforced appropriately. The researchers employed a mixed method design utilizing qualitative and quantitative methods. 240 teachers and 10 parents were recruited from special needs centers in Abu Dhabi. Fondi and Zahuruddin utilized interviews and questionnaires. Fondi and Zahuruddin found that ABA strategies significantly improved academic achievement and social skills. Both of these studies investigated the effectiveness of ABA methods as a therapeutic approach for children with ASD. While Misi and Sharif highlighted improvements in communication, social skills, and behavioral development, Fondi and Zahuruddin focused specifically on academic performance alongside social skills. Each study suggested that the duration of therapy may have a significant impact on the extent of improvements seen in children. We will now take time to look at the current research that focused on interpersonal, emotional, and social skills. Abid et al. Conducted a study to assess the impact of applied behavior analysis therapy on the interpersonal skills of children aged 3 to 6 with mild autism spectrum disorder. The researchers focused on 5 components of interpersonal skills: social group skills, peer interaction, social communication and interaction, appropriate behaviors, and overall interpersonal skills. Using a quasi-experimental design with a pre-test post-test approach, they divided 30 children into an experimental group that received 6 weeks of clinic-based ABA therapy and a control group. The results indicated a significant improvement in interpersonal skills, with effect size ranging from medium to large, suggesting a positive correlation between ABA therapy and improved skills. Bordini et al. Aimed to explore social skills development in children with autism spectrum disorder through various interventions that included ABA, eye contact, joint attention, parental training, and video modeling. They formulated 3 hypotheses. The study found that there was a reduction in the level of prompting required over the intervention period for eye contact and joint attention. Zhu et al. Studied the effectiveness of applied behavior analysis in enhancing emotional and social skills in children with ASD. The research involved 60 boys aged 4 to 11 years divided into an experimental group that received 6 weeks of ABA intervention and a control group that received no intervention. The study found significant improvements in the experimental group regarding emotional regulation and social interaction skills compared to the control group. Specifically, emotional regulations showed a paired t-test result of t equals 4.57, and social skills scores had a t-value of 3.89. There was also a positive correlation between the frequency of ABA sessions and the enhancement of emotional and social skills. All of these studies emphasized the impact that ABA therapy had in improving social skills and emotional skills of children with ASD. We will now turn our attention to research that focused on communication skills. Hampton et al. Examined the effects of early intervention on children with autism spectrum disorder under 8 years old, with a specific focus on spoken language and social communication outcomes. They conducted a randomized controlled trial involving 68 children with ASD. The children were divided into an experimental group receiving a combination of discrete trial training and JASP plus enhanced Malay teaching, and a control group that received no intervention over 4 months with 3 sessions per week. The study aimed to assess improvements in joint attention and specific communication measures. Post-intervention results showed significant enhancements in joint attention for the intervention group, though no significant differences were found in any other measures. Caregivers in the intervention group reported using more effective communication strategies and expressed high satisfaction with the interventions. We will now take a look at some of the current research on types of communication in ASD. ASD is characterized by communication challenges and can often lead to nonverbal tendencies. Early intervention is crucial for optimal developmental outcomes. AAC tools, or augmented or alternative communication tools, can enhance communication for individuals with limited verbal language. AAC tools can also help in combating the stigma associated with nonverbal ASD, demonstrating communicative competencies. Misconceptions about nonverbal individuals often leads to misconceptions about their abilities and potential. Marvisakis' case study illustrated how an AAC device was able to transform perceptions and allow the subject to express complex thoughts. The subject of the case study was a 15-year-old male with severe dyspraxia, a type of speech disability that struggled with verbal communication. The subject's communication milestones were tracked and showed significant progress from age 10 to post 12 years old. Examining the picture exchange communication system, Alfuria et al. Explored the challenges faced by children with disabilities, specifically focusing on those with developmental disabilities in Saudi Arabia. The research concentrated on examining the effectiveness of Picture Exchange Communication System, or PECS, in enhancing requesting skills among children with multiple disabilities. The study recruited 3 participants from the Autism Excellence Center's Inclusive Education Program, employing a quantitative research design that utilized an experimental method. The participants underwent a preference assessment, a baseline phase, and training over 7 sessions to learn PECS. The results indicated that PECS training positively impacted the participants' communication skills, leading to an increase in requesting behavior. The researchers acknowledged limitations to their research design. On the other hand, Zohorian and Zerapishi investigated the impact of PECS on vocabulary acquisition among participants with autism. They hypothesized that using PECS would lead to significant improvement in vocabulary learning, as evidenced by an increase in correct word response during the intervention phase compared to a baseline phase. The study employed a single-subject experimental A-B design with 2 male participants aged 9 and 12. The participants were diagnosed with ASD and had limited social skills. The study involved 15 sessions with vocabulary assessments conducted through picture recognition rather than written tests. Implementation of the PECs in teaching vocabulary during the treatment phase included teaching vocabulary related to various categories such as animals, colors, and school objects. Each session began with a review of previous vocabulary, followed by a new vocabulary introduction using flashcards and picture books. The teaching process involved progressive steps through the 6 phases of PECs, with assessments conducted at specific intervals. However, the researchers encountered challenges to teaching the PECs. The study ensured high treatment integrity and reliability in observations, confirming the accuracy of data collection methods. Inter-observer agreement was consistently high during the intervention phase. Baseline data were collected to establish a consistent performance level for each participant. The intervention phase demonstrated significant improvements in vocabulary learning for both participants. The data showed a marked upward trend in performance during this phase. A qualitative analysis of videotape sessions revealed various behavioral patterns and challenges faced by participants during the intervention. The study concluded that the picture exchange communication system is an effective intervention for teaching English or vocabulary to children with autism. Both studies aimed to assess the effectiveness of alternative communication devices, and they focused on different aspects. Alfuria emphasized requesting skills in children with multiple disabilities, while Zahorian and Zarafishi concentrated on vocabulary acquisition in children with autism. Marvitakis, on the other hand, examined an AAC device. All 3 studies contributed to the evidence of the effectiveness of PECs and AAC devices on enhancing communication and requesting behaviors. Now let's take a look at the current research on social skills training. Chung et al. Investigated the effectiveness of robot-mediated intervention aimed at improving social skills in children with ASD, with a specific focus on verbal initiation frequency, eye contact frequency, and eye contact duration. The researchers hypothesized that the intervention will lead to significant increases in these areas, enhance overall social motivation and engagement. The study involved 15 children aged 5 to 11 years diagnosed with ASD and used a 3-phase design: a pre-intervention, intervention, and maintenance phase, along with a single subject research approach. An NAO robot was utilized to facilitate social interactions. The results indicated significant improvements in eye contact duration and verbal initiation frequency, with strong Tau-U scores demonstrating positive correlations. These improvements were maintained at post-intervention, and the intervention also enhanced social motivation and cognitive flexibility despite an initial learning curve among participants. This study also faced several limitations. We will now examine research that focused on a completely different method of teaching children with ASD using an applied behavior analysis method called discrete trial training, or DTT. Peterson et al. Aimed to assess the effectiveness of a behavioral intervention grounded in ABA for addressing deficits in children with ASD. The primary hypothesis was that a mixed model approach, which combined DTT with mass trials, would yield statistically significant improvements in target behavioral goals over time. The researchers utilized the Verbal Behavior Milestone Assessment Placement Program, or VBMAP, and the Assessment of Basic Language Learning Skills, or ABLES. A pre-test post-test design was employed to assess the impact of the ABA interventions on verbal skills. Participants underwent 2 verbal assessments with a 6-month interval. 12 children were assessed using the VBMAP, and 21 were assessed using ABLES. Data was collected retrospectively from electronic medical records by trained research assistants. Participants received a mixed methods ABA treatment approach, which included DTT, mass trials, and natural environment training. Each participant received at least 25 hours of ABA therapy per week. Treatment plans were tailored to individual needs by board-certified behavior analysts, or BCBAs. A team of behavioral technicians delivered the interventions in a structured or naturalistic setting. The VB map assessed 13 verbal milestone domains, while ABLES evaluated 8 behavioral milestone subscales. Both assessments showed high internal consistency. Statistical analyses revealed significant improvements in verbal skills post-intervention. Paired t-tests indicated significant effects for 11 of the 13 VB map scales and all of the ABLE scales. Effect sizes ranged from moderate to high. The study involved a sample of 33 individuals with autism, aged 2 to 16 years. The duration from baseline to post-test ranged from 4 to 8 months. The VB map results demonstrated significant increases in various verbal behavior skills following ABA treatments, highlighting the effectiveness of the interventions. Key areas of improvement included manding, tacting, and listener response. The ABLES results indicated substantial improvements in language and social skills among individuals with autism, reflecting the positive impact of ABA treatments. The enhancements spanned various language domains, including receptive language and social interactions. Ali and Fazil set out to evaluate the effectiveness of DTT in promoting social communication skills among children with ASD. They structured their investigation around 4 primary questions that asked how effective DTT was in fostering social initiations, what situational contexts facilitate the best application of DTT, how effective is DTT when deployed in specific environments, and what context is the most conducive to developing social initiations. The researchers hypothesized that DTT would lead to significant improvements in social communication skills. They utilized a single-subject experimental design featuring 5 distinct phases. A baseline phase, followed by 4 intervention phases. During the baseline, 10 sessions were conducted to establish initial measurement. The intervention phases employed core strategies of skill acquisition, including shaping, prompting, prompt fading, and tangible reinforcement. The results indicated a significant correlation between the DTT interventions and improved social communication skills, particularly in social initiation, reciprocal interaction, eye contact, conversational patterns, and sharing interests. Lastly, we examine the Premack principle in our literature review. David Premack demonstrated that preferred activities such as playing a video game or eating candy can effectively motivate children to complete less preferred tasks, but this would only be true if the child had a clear preference for the rewarding activity. The Premack principle is a concept in reinforcement which suggests that engaging in more preferred behaviors can be used to encourage less preferred behaviors. This concept is often illustrated by saying grandma's rule or a first thing contingency, which implies that you must do something first you don't enjoy, such as eating vegetables, before you can then do something you like having dessert. Bilal et al. Discussed the increasing use of remote delivery methods for language and cognitive training in special education, particularly in response to the COVID-19 pandemic. The researchers outlined procedures for developing and implementing computerized DTT programs using common software tools. The COVID-19 pandemic accelerated the shift to telehealth models, and remote delivery models are becoming essential in special education settings. Bilal et al. Conducted field tests at 3 locations using a small group of participants with standardized curricula like PEAK and PRISM. Bilal et al. Emphasized the importance of generality and transportability in ABA-based interventions, particularly in the context of telehealth. They highlighted how these concepts can enhance the effectiveness of treatments for children with disabilities. Bilal et al. Also provided guidance on developing DTT programs using Microsoft PowerPoint and Boom cards for both expressive and receptive communication training. They explained how training procedures could be adapted for teaching chain tasks using the live curricula. while Bilal et al. Discussed the creation of receptive communication programs using PowerPoint and Boom cards. They also emphasized the importance of customizability and immediate feedback for learners, outlining the steps to build effective programs that facilitate learning engagement and correct responses. A critical component of remote delivery methods is maintaining learner attention and engagement during remote sessions, as well as addressing the loss of subtle social reinforcers in virtual formats. Bilal et al. Thought remote delivery can lead to deficits in learner attention due to the absence of social reinforcers. Implementers were encouraged to be more animated and engaging during sessions. Computerized programs enabled the embedding of reinforcers such as YouTube videos to enhance engagement. Lastly, Bilal et al. Thought that the implementers should employ the PREMAC principle to motivate learners by linking preferred tasks to less preferred ones. Caregiver involvement was particularly important in remote programming and addressing the challenges of ensuring implementation fidelity. However, Bilal et al. Presented strategies to enhance caregiver participation and reduce errors. Although the studies provided adequate research indicating that ABA-based treatments could significantly improve communication and social skills, they each had several limitations. The limitations that were found included small sample sizes, results not being generalizable to the overall population of children with ASD, poor methodology or a lack of detailed description on the methodology, the inability to reproduce the study, or they had no comparison group. What biblical perspective can be applied to autism spectrum disorder and applied behavior analysis interventions? Biblical truths. There are several biblical truths that can be applied to this study. However, the significance of every person is one biblical truth or principle that stands out. Autism is a disorder that can lead individuals to feel isolated from society or perceive themselves as markedly different from others. Applied behavior analysis can serve as a personalized method to assist those with social and communication challenges in comprehending social situations and voicing their thoughts. The Bible teaches us that we are all created in God's image. That can be found in Genesis. This truth emphasizes the intrinsic worth that every individual holds. The studies highlighted the importance of tailoring interventions to meet the needs of the individual, reflecting the biblical principle of valuing and respecting all individuals. A second biblical truth that can be applied to gaps in the research. Are there gaps in the current research on the long-term outcomes, maintenance, and impact that applied behavior analysis interventions have on autism spectrum disorder? The previous slide asks if there were gaps in the current research. Several gaps have been noted. There is a lack of research on the long-term impact of discrete trial training and social skills training. There's limited research on the long-term outcome of the use of applied behavior analysis key principles such as the PREMAC principle. Long-term outcome of using PECs or an AAC device for communication also have limited research. The purpose of this current proposal is to fill gaps in the current research by examining the long-term outcome, maintenance, and the impact of methods used in ABA interventions. Research question. The research question for this proposed study are: what are the long-term effects of applied behavior analysis interventions, specifically discrete trial training, social skills training, the PREMAC principle, and the use of the Picture Exchange Communication System, PECS, or augmentative and alternative communication devices, or the AAC device, on communication and social communication outcomes? The methodology for this proposal. The variables being examined are the independent variable is the long-term effect of discrete child training, social skills training, the PREMAC principle, the picture exchange communication system, and alternative or augmentative communication devices. The dependent variables are communication and social skills outcomes. There are two hypotheses. Hypothesis 1 is long-term outcomes of ABA-based interventions, which are discrete child training, social skills training, the PREMAC principle, picture exchange communication system, and alternative or augmentative communication devices will show maintained improvements in communication skills in follow-up sessions. Hypothesis 2. Long-term outcomes of ABA-based interventions of discrete child training, social skills training, the PREMAC principle, picture exchange communication system, and alternative or augmentative communication devices will show maintained improvements in social interaction skills at follow-up sessions. "280 participants will be recruited from schools and ABA clinics within my area. Participants would be divided into two groups of 140, an intervention group and a non-intervention group. Equipment and materials would be those utilized during sessions, such as stimuli for DTT, a PEX board or a book, AAC device, a first then board for the PREMAC principle, group schedules, behavior contracts, and token economies for social skills training. Written permission would be obtained from parents. Participants would be evaluated over time every 6 months for 24 months. The assessment of basic language skills or ABLES and the Verbal Behavioral Milestone Assessment Placement Program, or VBMAP, would be used to assess progress at baseline, 6 months, 12 months, 18 months, and 24 months. Assessments would be conducted by BCBAs or behavioral analysts located within the clinic or schools. The analyses that can be utilized to examine the data are a descriptive analysis, which can summarize the data, including means, standard deviation, and frequency distributions for the dependent variables in both groups, intervention and non-intervention. A MANOVA could examine multiple dependent variables simultaneously to see if there are differences in the means of their variables based on the independent variables. The MANOVA would most likely be the most suitable analysis for this research design. There are some limitations and pitfalls for the study. While the sample size would be statistically significant, the homogeneity of the participants may limit the generalizability of the findings. Confounding variables may arise with the distinctions between those receiving ABA interventions and those who are not. Variability in the delivery of the ABA-based methods may alter the results. Level of symptom severity and participants' ability may also alter outcomes. 3 pitfalls that may be encountered are sampling bias, environmental factors, and attrition rates. You may ask, what would be gained from this study? The study would provide information about long-term outcomes of ABA-based intervention methods. The study would enable more targeted interventions utilizing ABA methods. The study would examine the long-term outcomes of using DTT, PEX, AAC devices, and the PREMAC principle, enhancing the current research. It would allow current methods to be maintained, reformatted, or improved based on the study results. The study would also provide insight into the effectiveness of the ABA-based treatment methods over time. Conclusion and references. The conclusions that can be reached from this study, if the alternative hypotheses are accepted, are that ABA interventions are maintained over time. Social skills are expected to show improvement from the baseline at the 6-month assessment intervals. Communication skills are expected to show improvement from the baseline at the 6-month assessment intervals. I would like to make a note that all images were obtained from the Creative Commons or Adobe Stock Images unless otherwise specified by a reference on this slide. Thank you for watching my presentation.